And I want to guide us first to a start screen. What this is it's allowing us to create a web portal, an area where we can actually log in and see some information at a top level. This might be a start screen for a user. This might be a KPI given to management. There's a lot of opportunities here, but this is just an introduction to how we can get into BPC. So some of the things that I do want to draw your eyes to here is we actually have just some key metrics that make up information that is pertinent to the healthcare providers. And what this is it's a KPI-driven dashboard pulling data in directly from our BPC server in the back end. So we can see it's updated, it's bringing us variance reports in. We have different trends we can view depending on what our goals are within our organization, as well as then I want to draw your eye over here to the right, which is our action pane. And our action pane here is really where we are in the system and what we can do in the system. So this top part is this concept of a current view. And what we've done is taken, in this case, the financial view or the GL view of a healthcare provider and broken it into, we have our GL accounts, we have our business units, our cost centers, our different categories which allow us to keep not only our actuals, our budgets, and our forecast all together, but different iterations of each of those, that if we have multiple versions of our budget, we can use that to help leverage some of the changes that we're seeing and do what-if analysis. Our different cost centers, our data sources will help us isolate where the data is coming in from, and we can have multiple sources feeding it, whether it's a GL transaction system, a HR system providing us employee-level information, or a patient-type database or system in the back end providing us patient-level information, as well as our time dimension is giving us the ability to look at things, whether it's monthly, quarterly, annually. We've even built applications gone down to the week and day if necessary, depending on what the needs are for reporting and analysis. So that's our current view, and as you'll see, this part of the action pane is going to follow us as we go through the system. The central part here is what we call our tasks associated with what this is. One of the nice things about BPC is it really has a dynamic security model built on Microsoft Active Directory. So a single sign-on, the same as you would log into your computers every day, will actually help you set up a user to, one, see certain intersections of data, right? They may have access to certain departments, but you also grant them certain tasks that they're available to do. And this is really key when you have a user that doesn't interact with the system very often, but has key things they need to do, is by allowing them certain access, they will only have certain tasks available to them, and that will help limit them and not feel overwhelmed with their interaction with the system. As well as always in my action pane, I can get to any of my other areas within the software, and then I have help menus always available to me. So I'm actually going to jump from here into what we call a business process flow. And the business process flow was a concept that they came up with that said the average user of a planning and forecasting tool is to go in maybe once a month, once a quarter, a couple times a year to do your budgeting and your forecasting. If I have to relearn the system every time I have to reconnect, it's going to be cumbersome and overwhelming. So what if I set up something that gives me a step-by-step interaction with the system? So this business process flow is a highly customizable step and sub-step set that can be set up for particular users, particular groups of users. So you might have your nursing department managers have their own business process flow. You might have the people in charge of reimbursement taking care of their business process flow, etc. So you can see we have multiple options there. And so the first thing I want to jump into here is, as you can see, I have lots of different choices, but I'm going to give us some key highlights today. I'm going to go look at some of the assumptions. So some of the key areas for healthcare planning is this concept of being able to build out assumptions. And this is a universal assumption we talked about that can spread its way, across the organization, so everybody can actually see and understand all the data and how that's going to drive this forward. And we can see that the way this guy is laid out, we have information from prior year, we have current year, we have forecast information, as well as we can go forward and work on our budget to the right. And then we can actually see how this information breaks itself down by department here. And you can see that you have, in this case, the volumes by the major patient types. And this includes inpatient acute admissions, inpatient psych, rehab, outpatient surgery, outpatient general, etc. And if we look at this first section here, we can see that this is inpatient acute admissions. And from here, we can actually see how we have all these various different ones to look at And then to the right here, if we scroll to the right, we have in the same template the ability to manipulate our budget. So we have our admits and our length in here, and any of this yellow information we can modify to help project down the mixes that are going to go in here. So for example, if we look at wanting to change our information here, we can actually go in and change it by, say, a percentage. We want to go up it by a percentage. We have the ability to weight that and increase that. Now it's going to see it's not only changed this number here, it's affected the assumptions down here by department. And once I submit this information to the database, the changes will be available across the board into all these departments as part of their assumptions to be used later on in the planning process. So you can see that you can really set up some robust global assumptions here, because that's really one of the things is you want this to be an interactive process that you might set up as much data ahead of time, but be able to make the modifications and track those modifications, whether it be by a department manager, somebody in charge of all of the and we'll see, I'm going to jump now into departmental budgeting. So one of the key features of BPC is this ability to take and make this fit your organization. So what we've done here is we've created some options for planning at the department level. In this case, I'm going to plan for a single department here. This is our James Wilson unit. So a view from a single individual department. But I wanted to take a few minutes and talk about the different options when you have this type of planning taken into account. So for example, here I have a recap. And this is one of the things we've tried to include in a lot of our templates that are shipped with the Accelerator. And what this is a high-level glance at things, once again using that concept of show me what I had, what I'm looking at now, and what my future is going to bring with some key variances. So there is a lot of detail behind a lot of this. A lot of this is driven by, we talked about those assumptions and those drivers, but I want to be able to get a high-level look and see how things are looking in total so I can quickly see where I may need to go do some modifications. And we can see from this information that you can actually get to the key figures that are important and the key indicators that help me manage not only what the current information is coming in, but what my future is going to be looking like. So I'm going to move into workload revenue now. And what this is going to do for me is show me some of the different areas that are important on my workload revenue planning. So for example, up here at the top, once again, we see our global drivers are coming in for us. So we can see now, once again, I'm in that single individual department, and I have my global drivers. Now from there, I can see this global information and start making modifications to it. Whether I'm going to change the volume, I can change some of the acuity information. All of this information is available for me to see and modify as I need to going forward in my budget while seeing the historics and see how things are trending for my information. I'm going to move on to now a little bit on the staffing side of things. So this is a dynamic area of VPC that can be customized depending on how your organization plans for headcount. We know this is an area, if it's planned accurately, is very controllable, but if it's not taken care of accurately, can spin out of control. So we have seen different levels of detail when it comes to planning for salary. For example, I have a healthcare organization who does plan by employee. They are able to spread it out and get they have more than 2,000 employees in their planned individually by headcount. I have another organization that does it by employee type. This one is looking at it more from a job code level. Once again, we have up top is our summary information, really giving us an idea of how things look on a high level. And then going down here into the actual department type groupings or the job code. So this is, in this case, is for the variable nursing planning. And you can actually go in here, override their certain rates, override their overtime here. So that these modifications allow the department managers to actually interact with this data. We've set us global assumptions up, but we also can give them options to override some of those, knowing how that information is going to be changing, how it differs for their department than for the global scheme. And one of the things that's in here is all this information is being calculated based on what we have over here. It's called a staffing grid.